here again with an update on COVID-19 in Bristol and what we're doing to keep you as safe as possible. At the moment, our rate of infection is at 396 cases per 100,000 people. This compares to 418 cases per 100,000 this time last week. So it has decreased slightly, but we are plateauing. Cases have leveled off at about 300 per day with fluctuations in the infection rate. Our infection rates remain high. The virus is circulating widely in the city and in the background, so we are still vulnerable. The England rate stands at 325 cases per 100,000. So you can see we're still above that rate. In our hospitals, we have 99 people unwell with COVID at the moment. Again, the vaccines have weakened the relationship between catching the virus and hospitalization, but the connection is still there. And our rates of numbers of people in hospital have increased. So be aware, please do. So we're encouraging you to continue to wear a face covering unless you're exempt, particularly important on public transport in crowded areas and when you may come into close contact with frontline workers. Small acts like this are critical in stemming the spread of the virus, but they also send a message about you caring for people around you. And I think particularly if those retail workers, where so many people come through the shop every day, someone just wearing a mask just shows that you care about them too. So please bear that in mind. There are lots of festivals on at the moment across Bristol and the Southwest. So we encourage you to take lateral flow tests, that's the rapid test, before and after you attend. If you come back and you're unwell with symptoms of COVID, please self-isolate immediately and book a PCR test. It's important you don't go into work or see friends when you're unwell. That reduces the risk of spreading coronavirus or other illnesses. Would you bear in mind, we are, COVID-19 is obviously what we're talking about, but the risk of other, other viruses sweeping and picking up pace during the autumn into the winter is very, very real. On a vaccination front, as of Wednesday, the 8th of September, 293,000, that's 67% of people over the age of 16 in Bristol had been fully vaccinated. That compares to the England average for fully vaccinated population at 72%. So we're still below that England average. We have to keep pressing forward with the messages and the support to make sure people get their vaccinations. From Thursday, the 11th of November, if you are required to enter a care home as part of your professional responsibilities, you will need to show evidence of vaccination or exemption unless you're under the age of 18. This means you'll need to receive your first dose by next Thursday, the 16th of September, at the latest, to give you that 8-week period to get your second dose. Roles this could also affect include funeral directors, hairdressers, food delivery, drivers, and maintenance. So a full list of those people who do and don't need to provide evidence can be found on the government website. If you haven't had your vaccination yet, it's not too late. Visit www.grabajab.net to find out how to book or where your nearest walk-in vaccination clinic is. Now, people have been going back to our museums and libraries. If you have plans to visit one of them, we encourage you to continue with key behaviors whilst visiting. Wear a face covering unless you're exempt. Give people space. Don't visit if you have COVID-19 symptoms. Book PCR tests regularly. Check in using the NHS test and trace app. Again, they help us stem the spread of the virus and they show people you care. Please continue to do all you can to protect yourselves and keep others safe, including our frontline workers. Be kind and respectful towards each other. Be gracious. If people ask you to put a covering on, keep your distance. Graciousness is what we need at the moment. There are lots of people out there who are really worried. And that person themselves may have a health vulnerability, or they may be going home to someone with a health vulnerability and don't want to pick up the virus and take it home for them. So please bear that in mind in your interactions with other people. Okay, we all have a part to play. Have a good day, keep yourself safe, and be well.